Gentlemen and ladies, welcome back to the discussions in the series of discussions regarding the principles that guide development of skills in formulation design. So after having looked at weights and measures, now we begin to look at how do we present the formulation dosages in terms of strength, and how do we calculate those strengths, and how do we manipulate them, because this is crucial as skills in formulation design. So part of the introduction, just to emphasize that medication strength and calculations are essential skills in pharmaceutical compounding. And so this lecture tends to remind you about the units that we have discussed already, the standard units that are used in weighing, in measuring, and how we apply these in presentation of strengths. And so this lecture will also cover the expression of strength, and also cover practical calculations methods for the theory behind, and then that prepares you for the compounding sessions in the lab. And so quickly, medication strength concepts. We begin with units and measures in pharmacy, and just to remind ourselves that we've already covered that weights and measures in pharmacy use standard international system based on grams and liters. And so with the grams we have several sub-units, and liters several sub-units that we should be comfortable to adjust from the larger to the smaller ones, and adjust back to the larger ones from the smaller ones. So accurately weighing and measuring is very, very important in compounding, because then this will ensure that we have proper dosages, these dosages that are actually safe without medication errors. What are the different expressions of medication strength? So if you find, for example, a liquid product has been prepared, the question is, what is contained in there, the unit of issue? That is crucial in understanding, because then you will know how much has to be dispensed to the patient and how they are going to be using those medications. So issues of medication strength expressions are very, very important. Examples will be given in this lecture. So medication strength can be expressed as millimoles, okay, milli equivalents, percentages as well, where we have weight per volume, also as ratios where we have a solute in a certain quantity of the product. So understanding these expressions is very, very important in interpreting prescriptions, and so that when you have interpreted the prescription, then you should be able to prepare a suitable dosage form for the needs of the patient. Let's try and focus on calculating strength using millimoles and milli equivalents, and I think for this it is important to understand the principles behind, so that when we get to the lab, then we'll be able to use them accordingly, and then we'll have known the principles behind. So calculations involving molecular weights for millimoles and equivalent weights for milli equivalents. These are very, very important. So example is where we want to calculate the number of grams required for a specific, for a specified millimole concentration of the solution. So sometimes you may want to have the molecular expression of the quantity of substance that you want to achieve as a concentration. And then you have to work backwards to understand how much should I weigh to be able to produce a particular concentration. So that's where these millimoles and milli equivalents come in. It is also very important to understand that, for example, for milli equivalents compared to millimoles, For media equivalence, we are dealing with electrolytes. Okay, so for example, if we want to produce normal saline, what amount of sodium should we use? If we want, for example, in an acidic medium, how much of the proton concentration do we need to have? Those will have to be expressed in media equivalence. Then we also have percentage strength calculations here, where, for example, we have a percentage weight per volume. And so there's a meaning behind this, that this formula, you use a formula, grams of solute per 100 mils of solution. So percentage weight per volume means we have some amount of solute in grams per 100 milliliters of solution. So the 100 is the percentage that is expressed in there, and the V implies that the product is liquid in form, and the W there means that we are dealing with a solid that is weighed to be dissolved in the solution. So an example given here is where we are preparing 0.9% saline, which is sodium chloride, or 5% drug solution. And obviously then we are going to have to calculate the exact mass of the sodium or the drug that should be added or needed to produce a final volume of a solution. In terms of strengths and calculations for medication presentation, we also need to understand dilution principles and the types of dilutions. So when you receive a prescription, for example, you may find that maybe you have a prescription that is talking about a particular substance in a certain amount, okay? Or we have a particular substance to a certain amount. So you pay attention. The first one is you have a particular amount of substance in the final product, okay? The other one is where you have a particular amount of substance or drug to the amount of solvent that is needed. So if we have one in X, it means that we have one part of a particular solute in the total X parts in the solution. If we say it is the strength of this product is 1 to X, then it means that we have one of a particular drug solute to X parts of the solvent. So this is very, very important. So in the first one, you are dealing with the total solution. In the next one, you are just comparing how much of a drug you have compared to the amount of solvent that you are using in that part. So understanding this is very, very important in producing correct strengths so that you have less errors and you assure safety of the patient. Then we also have calculations relating to quantities that are needed in solutions and dilutions or diluents. The steps, and I think we have hinted on some of these, the steps would include determining the required solute of mass. So obviously then you have to weigh, as we indicated in the last topic. You weigh. After you weigh, you calculate the concentrated solution volume to use. And when you have done that, so you can see that you are doing a lot of calculations and weighing, then you add the diluent to achieve the final volume. That is very, very important. And so then we'll be looking at some of the principles we have to use in the lab when we are comparating substances together, and then we apply the correct techniques. So you can actually do some worked examples to illustrate some of these steps when we get into the lab. So some of the calculations would involve determining the amount of a solute required for the final volume, okay? So if we want, for example, the final volume is 500 mils, where do you start from? So a number of calculations have to be done, but obviously first of all we have to determine how much solute do we need to dissolve in a particular solution and things like that. Again, we want to produce a particular amount per particular unit of issue. That would be the strength of your dosage form. So this includes weighing the active ingredient. When you have done that, you select a suitable volume of the solvent for what? For dissolution. When you have done that, you accurately measure the solvent to make up the final volume. So consider solubility limits and the total volume. Why? Because we want to avoid overflowing, but also we want to avoid producing precipitates. Let's look at some of the practical applications of medication strength calculations. A stepwise calculation example with a detailed explanations where examples you show stepwise preparation of a mixture. For example, we have ammonium chloride and sodium chloride being put together. Each step includes weighing solids involving in a measure of solvent volume, adding some ingredients in there, but obviously the final volume adjustment is important to ensure accuracy and also stability of the pharmaceutical preparation. So a number of considerations to make there. What if we want to prepare a solution with varying concentrations from the stock solution? Again, here then it means we have to do some dilutions, and so the principles of dilutions apply. So the demonstrations include diluting a concentrated bulk of a solution to achieve a particular target that is lower in terms of concentration. So what do? You calculate to determine the volume of stock solution required and the volume of the diluent to add. So some calculations there, dilution equation needed, but we can also just do a stepwise approach to this. This will enable flexible preparations of different strengths of a particular solution, depending on what is needed by the patient. Quickly, some of the tools that you need and the techniques needed. Basically, you need to be able to weigh. Remember, we've talked about the equipment. We have measuring cylinders, we have conical flask, we have the weighing machines, and so you have to do that. When we come to do the actual preparations, you are going to look at some of the techniques that we use, for example, doubling up for powder mixing, and how we want to ensure that there is a technique that we can use in incorporating different or several powders together to make a final formulation. Some of the procedures are important, but the idea is that you should ask yourself, is there a procedure? If there is a procedure, stick to the procedure for repeatability, so that when you make that, again, you come and refer to the same, and another person can make the same standard and quality of a formulation, because that is important. So standard operating procedures are important for labeling, measuring, and final preparations. Double checking is crucial. You can involve a colleague to double check your work, but also make sure you are able to record even the batch numbers for traceability and also minimizing errors. Otherwise, the key points are that medication strength calculations are fundamental for safety and effective preparations. Understanding units is crucial so that you can easily handle prescriptions. Dilutions can be needed, and the preparation techniques are very important to perfect to ensure product accuracy. Proper use of equipment, which equipments are needed, and this is important to ensure that we minimize errors. And then the idea is that the principles that we gain will help assure high quality compounding for the medicines that are tailored for patient needs. Otherwise, best wishes. See you in the next topic.